Welcome to joining the Cerebral Palsy Research Network. My name is Paul Gross, and I'm the President and CEO of the CP Research Network, and I look forward to telling you about our background, what we do, and how you can join with us in these efforts. The CP Research Network was born out of an NIH workshop on CP that happened in the fall of 2014. That meeting was quite unique because at the end, the organizers of the meeting stood in the front of the room and they assigned to speakers and participants specific key areas of action that came out of the meeting and asked them to form task forces to advance these concepts. Those were to start a national CP registry, which I led with Deb Gabler, pursuing comparative effectiveness research questions, which was assigned to Dr. Diane Demiano and Dr. Rich Stevenson, increasing the study of adults, assigned to Drs. Mary Gennady and Debbie Thorpe, and then bringing more young clinician scientists into the field was assigned to Dr. Jonathan Mink, and NIH took the responsibility for advancing basic and translational science for CP. At that same meeting, a mother and blogger about CP, who had the blog CP Daily Living, Michelle Schusterman, decided that what was needed was evidence-based information for parents with a new diagnosis of CP. And she came out of that meeting and formed CP Now to provide that easy-to-read evidence-based information. And then she also was very focused on the well-being of people with CP and the well-being of their families, caregivers. And CP Now was also committed to funding important research. We began collaborating at the very outset of CP Now and CPRN, with Michelle Schusterman providing community engagement services to CPRN, and CPRN providing just strategic input into their business operations. In 2021, we decided to merge these four websites, these two entities together under the name the Cerebral Palsy Research Network, or CP Research Network for short. The mission of the combined organization is to optimize the lifelong health and wellness of people with CP and their families through high-quality research, education, and community programming. More detailed is the vision, which is really aimed at engaging the entire community. So not only people with CP and their caregivers, but the vast number of health systems that treat CP together into a learning health network for CP, which would allow us to all focus our research and our care pathways of people with CP on the health issues that were really the most important to the community for their participation and for their quality of life. We gather from the community their lived experience and share them so that we can measure aspects of the healthcare delivery and process improvement to really make it so that their health and well-being is getting better in ways that matter to them. So to look at some of our key milestones in our first 7 years of existence, you can see on the right sort of where we spent our money over that time frame. The lion's share of the investment went into research and quality improvement, and secondarily into education. Some of our key milestones were we launched that clinical registry in March of 2016, and it now has more than 5,000 patients. We got funded by the Patient-Centered Outcomes Research Institute to pull together a patient-centered research agenda for CP, which we call Research CP, and we went on to have that published in 2018. We went on to get significant public funding milestones for both our registry infrastructure and for a genetic study specifically. And then in 2020, we launched 4 quality improvement efforts across the network. To date, we've had more than 6 publications, more than 20 academic presentations, and numerous manuscripts that are being developed. On the educational front, we did launch that CP toolkit and have now served more than 4,000 people with that, either as a printed booklet or as a download from our website. We went on to release a well-being guide for caregivers, and then we translated the CP toolkit into Spanish and into Portuguese. And then in 2020, we launched MyCP, which is a personalized information portal that's part of the CPRN website. And on the wellness front, we launched a virtual wellness program called MyCP Fitness in June of 2021. And then we went on to partner with the National Center for Health, Physical Activity, and Disability to provide the mentor program, or mindfulness, exercise, and nutrition to optimize resilience for members of the CP community. So to give you an idea of our registries, I'm going to talk about two key data points: gross motor function classification system and age. So the top two graphs show a snapshot of data from our registry, our clinical registry, when we had about 5,200 patients in November of 2021. And you see a U-shaped curve for the GMFCS, which is not a population view, and that's an important distinction of our clinical registry. These are patients that come into the clinic, and therefore you see a stronger weighting than you might see of a population view for the GMFCS 4s and 5s, because that greater involvement of CP very often means more visits to the clinic. And then on the right, you see our age distribution, and you can see that we have more than 20% of the patients in the registry are adults. But it's a very different view from our community registry, which gathers these lived experiences and patient-reported outcomes. You see that GMFCS is a little more evenly distributed, but with a strong bias towards GMFCS2s. And then you also see the age distribution, which definitely leans more heavily towards adults than our clinical registry. And that's from about 1,500 patients that we had, or community members, I should say, that we had as of August 2022. So the clinical registry provides a mechanism for collecting data in EPIC and soon Cerner, and a secondary mechanism of doing chart abstraction into REDCap. We support collecting data for the elements that are interesting to developmental pediatrics, to neurology, neurosurgery, orthopedics, and physical medicine and rehabilitation, as well as physical therapy. We also collect patient-reported outcomes via MyChart and through MyCP, including the Goal Outcome Assessment List, or GOAL, and CP Child. And we're really still, in some ways, in a startup phase in terms of deploying forms, collecting data, and establishing data transfer. So the way this data is collected into the clinical registry, the primary way is through the EMR. And so the clinician, in writing their note, clicks on a link, and it pops up a pop-up form where they click checkboxes and buttons, and then it goes and inserts that discrete data into their note. So we provide tools that help physicians build their notes that capture data from usual care into discrete CP data elements. But that means we're collecting the same format from all sites. Then the data is extracted and sent to our data coordinating center. The alternative method is to use our REDCap case report forms and to employ a clinical research assistant to do chart abstraction. These are done either on a partial population or the full CP diagnosis population. And that REDCap is set up at our data coordinating center, so the data goes directly into a centralized REDCap, and then it is extracted and loaded into our registry. So CPRN is a learning health network that spans more than 30 sites across North America. The green pins represent sites that are currently collecting data into the registry. The yellow pins are sites that are working on our technology. Red pin is a site that is working on the compliance, i.e. getting their IRB or research ethics approval. And the blue pins represent sites that have raised their hand and said they're interested in participating, but have not started the onboarding process yet. So we're very focused on accelerating research. So this is our research pipeline as it stands now. And so on the left side, you see the wide funnel where people either come to the network with ideas or members within the network are generating ideas, developing them to the point that they can be reviewed as a concept by the investigator committee, and then moving on to an application process. And then if funded, they get implemented, they execute, they produce data that then is used to generate evidence in the form of manuscripts and gets published. The orange ovals represent our quality initiatives that are in various stages of execution. And then at the top, we've got loosely a quality initiative of sharing our models of care, this sort of best practices from these centers of excellence that are members of the CPRN. So we talk about a learning health network. I want to build that up from a learning health system. So in the upper right, you've got represented that people and families with CP come into an institution, into a hospital, and as they're treated using our CPRN forms that are built into the EMR. That allows us to collect patient characteristics, record measures and scales, document treatments, and capture outcomes, all of which get stored in our registry. But as we make findings of evidence or as care pathways get established, we can then modify the forms and use this learning to modify the standards of care and always be improving the way we're treating. So a learning health network is a combination of these learning health systems that then share that same registry data with our data coordinating center that's hosted at the University of Pittsburgh. So the benefits of participating with us are a big factor is this multidiscipline knowledge sharing. So having these large sites that are sharing their model of care and the way they treat patients is a key element, as well as sharing along research lines. We improve quality of care through quality improvement efforts that are multi-center, and we have a group of ready and willing investigators who are working on a collaborative research portfolio that is truly multidiscipline and multi-site. And then lastly, between our meetings and mentoring, there's tremendous opportunity for professional development. So we do charge a participation fee of $15,000 a year that was established in 2021. This is really intended to create a sustainable revenue model so that we can continue our growth and hire additional professional staffing. So that funding supports our data coordinating center services, our scientific director, technical consulting for the implementation of EMR forms, quality improvement coaching, and our annual meeting. The fees make up approximately half of our revenue, with other revenue sources including grants, philanthropy, and sponsorship. So in conclusion, what is unique about the CP Research Network? It's that we connect the EMR and usual care to avoid duplicate data entry to create our registry. And then we can link that data to patient-reported outcomes. So we have clinically validated data that we can link to PROs. And this provides us with a platform for sustained research and quality improvement in the implementation of evidence. And that platform allows us to study the outcomes long-term for all of these interventions that happen when children are younger, and then we can follow them into adulthood. And this essentially is how we implement our learning health network for CP. Having completed this video, you've gone a substantial part of the way to understand what's involved in joining the CPRN. Send email to me at paul@cprn.org to convey your interest and intent, and then I can arrange with you any necessary informational calls with the provider team, your chief medical information officer, any people that would be involved in the process. I'll provide you with the participation and data use agreement, which you would need reviewed by your contracts folks, and then sign that and send that in. Then submit the CPRN registry protocol, which is available on our website. Some sites require that you do step 3 before you go on to do step 4. And then we meet to determine your data collection preferences and assigned resources to execute on that as appropriate. And we can then get you the EMR forms or REDCap access, depending on what is the best fit for your organization. And then you're ready to join our monthly investigator calls, join study groups, participate in our quality improvement efforts, and attend our annual meeting. Anyway, look forward to hearing from you.